Is heavy bleeding for 3 days a sign of implantation bleeding, or could it be something else?
Hello and welcome to our discussion today. We're going to tackle an important topic related to women's health: heavy bleeding. Specifically, we're addressing the question, is heavy bleeding for 3 days a sign of implantation bleeding, or could it be indicative of something else?
What is implantation bleeding?
Implantation bleeding is a form of spotting or light bleeding that can occur when a fertilized egg attaches to the lining of the uterus. This typically occurs 6 to 12 days after ovulation and fertilization. Implantation bleeding is usually light, often described as spotting, and may be accompanied by mild cramping. It is typically not heavy and does not last for several days.
What could heavy bleeding for 3 days indicate?
If you're experiencing heavy bleeding for 3 days, it's likely that it's not implantation bleeding. There are several other possibilities to consider. 1. Menstruation. This could be your regular period. Some people have heavy bleeding during their period, especially during the first few days. 2. Miscarriage. Heavy bleeding can be a sign of a miscarriage, especially if it's accompanied by severe cramping and passing of clots. 3. Ectopic pregnancy. This is a serious condition where a fertilized egg implants outside the uterus, often in a fallopian tube. Symptoms can include abdominal pain and heavy bleeding. 4. Gynecological conditions. Conditions such as endometriosis, fibroids, polyps, and pelvic inflammatory disease can also cause heavy bleeding.
When should you see a doctor?
Heavy bleeding for any reason should not be ignored. If you're unsure about the cause of your bleeding, it's important to seek medical advice. You should see a healthcare provider promptly if you experience heavy bleeding for several days, are feeling lightheaded, dizzy, or faint, are passing large blood clots, have severe abdominal or pelvic pain. In conclusion, heavy bleeding for 3 days is unlikely to be implantation bleeding and could be a sign of a variety of other conditions, including menstruation, miscarriage, an ectopic pregnancy, or a gynecological condition. If you're experiencing heavy bleeding, it's important to seek medical advice promptly. Remember, your health is paramount, and professional medical assistance is always the best route to understanding and addressing your concerns. Thank you for tuning in.